Hypovitaminosis in swine. So the main deficiencies are vitamin A, vitamin E, and vitamin K, as well as hypoglycemia. So A hypovitaminosis is rare. This is because the liver stores vitamin A and commercial diets are fortified with vitamins. However, it usually is caused by a beta-carotene deficiency, and ascarids can cause a decrease of vitamin A. For the consequences, there can be reproductive disorders in sows and altered cycling activity, as well as teratogenic piglets during pregnancy. They can be malformed, weak, blind, and have no eyes. They can also get immunosuppression, dermatitis, and incoordination and night blindness, as well as respiratory disorders. For E hypovitaminosis, it's usually with a selenium deficiency. It's usually associated with feed with high amounts of polyunsaturated fatty acids, copper, or vitamin A. And mycotoxins can also cause a decrease of vitamin E. For the consequences, they get mulberry heart disease, which leads to sudden death in piglets, usually between a few weeks old and 4 months old. They get myocardium necrosis, which leads to fluid and fibrin in the pericardium and fluid in the thorax. Hepatidosis dietetica is less common. They usually get sudden death, liver necrosis, and gallbladder edema. And white muscle disease is very rare in pigs, but they can get striated muscles. For K hypovitaminosis, this causes coagulopathy, which leads to bleeding, hematomas, and it can cause anemia and pale skin. And for hypoglycemia, it's found in nursing piglets, usually 2 to 4 days old. This is usually because they have low liver glycogen at birth and no brown fat, and a low body weight and a large surface area, and this can lead to heat loss. It can also be due to a low amount of maternal milk and an inability to suck. The signs are ataxia, low body temperature, seizures, and opisotomus. And for the treatment, try heating them and giving them glucose perox with artificial feeding, or you can give a 10% glucose intraperitoneal injection.